My goal is to give you an over-summarized summary of what has happened at the federal level, and more specifically what it means to the early childhood system in Connecticut that Connecticut is trying to pour itself into. And I've been introduced as the executive director of Team Inc., arguably one of the largest early Head Start and Connecticut early childhood providers in the state of Connecticut. But I would be remiss to tell you how much I personally, there's some powerful stories. I have the pleasure to introduce a parent very shortly. I graduated from the University of Connecticut with a degree in early childhood. I'm born and raised in Connecticut, love this state. Met my wife at the University of Connecticut, and she poured herself into early childhood as well. And my vocation, my roots started as an infant, toddler, child care worker. And again, I'll skip my story of self in the interest of time, but as you can imagine, Christy and I and my kids, and more importantly, this field for families and children in Connecticut, it didn't end well for us because we had a double dose of a currently broken early childhood and child care system. We were both workers in a child care system that does not compensate it. In fact, it pales in comparison to, I can make more money going to average DOL, Department of Labor data, I can make more money dog sitting than I could doing God's work with our most incredible emergent human beings called young children. And we had 3 kids and raised our kids here in Connecticut. And this lack of an adequate national investment and what Connecticut is trying to pioneer for this beautiful country, it really falls on the backs of families being asked to pay tuitions that rival or exceed their rent or their mortgage. And it falls on the backs of our workforce getting paid garbage compensation. Forgive my candor there. I'm going to tell you very quickly about the federal piece. 8 days ago, and again, close to 500 young children in Greater Waterbury, Lower Naugatuck Valley, South Central Connecticut, from Milford all the way up to Waterbury and beyond, including integral partnerships that we have with the Connecticut Office of Early Childhood, with their Early Start initiatives, beautifully braided programs that serves over 500 young children and families, and that includes unprecedented expansion of infant toddler capacity, that moms, dads, primary caregivers, our vibrant workforce, we're trying to attract our workforce, they are screaming for capacity at infant toddler as well as age 3 to 5. I got an email from a federal worker in Boston, again, 8 days ago, saying, we are gone today. The entire Administration for Children and Families in the Boston office has to leave today. We've learned this through an email. What this means for Team Inc., and this is not unique to us, this will be a reality for all early childhood providers in Connecticut, is we've been going through a 90-day process. Team Inc. is a May 1st federal grantee. Remember, Head Start and Early Head Start is direct federal to local. Federal government, the budget runs October to September. It's not operationally conducive to manage 1,000 Head Start grants across the country on one cycle. So they layer them across 12 months. So Team Inc. in this South Central section, state of Connecticut, and 500 young children and families, its grant deadline is May 1st. It's a 90-day process, so you submit everything programmatically, financially, local community need, what are families asking for and needing for. And again, we provided unprecedented capacity on infant toddler care as well as preschool age. 8 days ago, they're leaving, the people we've been working with, and they said, we hope you have somebody who can bring this home and connect with you. Perhaps you'll hear more from Washington. And again, that's 8 days ago. You add this layer of uncertainty and chaos, again, on top of a broken system. 2 days later, we got the formal notification from the Deputy Secretary of HHS saying that they've consolidated 10 of the regional Head Start early childhood offices from 10 to 5. So that includes Boston's gone, New York is gone, Chicago's gone, Seattle's gone, San Francisco's gone. We know how sparse it is in northeast portion of this country. I'm being a little cheeky there as far as Head Start grantees and population density. And so we are facing a major crisis here approaching May 1st. I do believe we will turn the corner. We are being very tactical on connecting through documented systems, albeit they're quite broken and convoluted. When you don't have human beings administering these programs, it creates unbelievable levels of chaos that, again, falls on the backs of our families, children, working families, and on a workforce that is already hemorrhaging due to 50 plus years in the making of a lack of a national public investment in this. So my big, takeaway for this is Connecticut, no one's coming to help you. And I say that with love, and I say that with admiration, what I said at the beginning. I'm still in the field of early childhood. I'm at a significant point of authority and privilege to do my small part for the cause. And I believe this session, and kudos to the Children's Caucus, our very own Representative Wielander, Farrar, and many others. I got to highlight Wielander, who's really in the front line in some of our local communities, and many other legislators, and seeing and hearing the governor's commitment and the lieutenant governor. Again, we can look back at this session and say this was a legacy moment. This was a moment where Connecticut and this country can learn from. We need a national bill, a shared economic, social, environmental, educational responsibility towards this prenatal to age 5 that can be transformative. In Connecticut, you can be the vanguard based on what you co-create together within the Connecticut General Assembly. And that is very inspiring. And so forgive my long-windedness. Please know nobody's coming to help with the federal. This is only the beginning of a very chaotic, uncertain, lack of attention to what matters most, our prenatal to age 5, absolute transformative. And with that being said, a couple of stories here. I have the privilege, whatever that means. I have the privilege. Try not to cry, folks. It's how you look, staff and families in this. We might be here May 1st. We may not be here May 1st. And then when we get through that, we may be here in October. We may not be here in October. And forgive me, you see, I'm singing to the choir here. Real privilege for me to introduce one of 3 stories of self that I hope we all walk out of here and think about the story of us and the story of now, the sense of urgency. Connecticut can be the difference. Let's give a round of applause to John.